Hey guys, it's Kristen. So it is October 21st. It is almost midnight, and I am going to do a completely different video. Obviously, you see the background. What's funny is I'm using Zoom to do this video because I am going to actually share my screen and show a few things on just basically what I'm going to talk about today. And I was just going through this and I was like, oh, I've already had the brick wall kind of already in a previous video. And I love the Northern Lights. It's been my dream. It's on my bucket list, like top bucket list to go see the Northern Lights. And it just looks cool. So I was like, well, I'm going to do it. And yeah. So, anyways, so this video is going to be a little bit different. I know in the past I said I wasn't really going to do videos talking about health care or health because I didn't want to feel like I was still holding on to that for myself. But I've just kind of had this really just feeling that I need to talk about this because I haven't talked about this. And this is a very kind of almost like exposing, but not. I am going to talk about what had happened when I was working in the healthcare industry. And I started working in the healthcare industry in 2013. And excuse me if you hear me, clear my throat like that. I've just kind of been sick a little bit. And so, excuse me if, you hear that. And if it's annoying, I'm sorry. But yeah, I've had a lot of things happen. I've seen a lot of things. I think a lot of people don't really know truly what goes on in the healthcare system. There are things that I just was shocked to see. And I was very young. I didn't know, I didn't know a whole lot. It wasn't until my last job that I really started researching and studying and looking into certain things about workplace laws and ADA, short term disability, long term disability, just because I was in a hellhole of that for a while. And so I am not at this moment going to name any names at all. I'm not going to name any coworkers, any supervisors or managers. I will say the company name, but that is it because at this time, I just don't feel comfortable, doing that. And I also don't want this to look like I'm trying to make a company look bad or make a doctor look bad or anything like that. I am just doing this video because I want to express my experience, what happened with me and my previous jobs in the healthcare system and what I dealt with and also what I've learned. And so I'm really going to try to put this together as best as I can. Like I said, this is kind of new. So if it's kind of different or flip floppy, I'm so sorry. This is kind of my first time doing this, sharing the screen on certain things. Um, so let's start off. So my first job in the healthcare system, I was lucky enough to have a friend of a friend who just happened to say, hey, I work for this healthcare company called TrueFit, and they're looking for people to hire and you don't have to have experience in healthcare, and just send them your resume and you may get it. And that's what I did. I sent my resume in and I got an interview, and honestly, I did not think that I was going to get the job. I honestly didn't, but I prayed about it and I left it to, God and the universe. And obviously it was meant to be for me to get the job. So I got the job to work for a pain doctor. And this pain doctor actually lives in Texas in Houston, and it would fly every 2 weeks in our office. And honestly, it was crazy, but it was actually a really fun job. I really enjoyed that job. And I think it was called Advanced Invasive Pain Management. But I was hired at first to be a muscle tester. So what they did was they gave me this instrument that patients could like push against with their chest and with their arms. Like they would actually push against, like, you know, into this, you know, muscle tester thing that I was given. And I would look at the number and I would write it down and put it in the computer and save it for the doctor to see. And I think every muscle test that I did, I would get, I think, $5 for it, and I was 10.99 at that time. But it adds up for how many patients that you do. And at that time, I didn't know that, you know, some of the muscle testing, that was sent off to patients' insurances, some of them were not getting covered. And so that was kind of my first actual experience of, that's kind of odd, that you wouldn't be covered for that, especially if the doctor wanted that information. And I really stopped at that point. I stopped doing a lot of patients with the muscle testing because I just didn't feel right after that. Uh, it was it was a it was a fun job, and during that time, and I want to say it only lasted till 2014 or 15. I think it was 2015. But there were a lot of different things that were going on while I was working there. And I actually ended up getting hired with another company that was also working with the same company, with TrueFit. So it was like a client of TrueFit's, but they were entangled together, and he hired me. He hired me to do urine testing. So that was interesting because I've never done urine testing before. And a lot of people may think that is disgusting. They would never do that. But to me, it was an opportunity for me to do something new, even though it was weird. For me, it was very kind of gross. It was gross. I'm not going to lie about that. But it was something new, so it was interesting. I like to do new things. I like to learn and do new things because I like to be pushed. I like that. I don't really like being in the same spot, because if I'm in the same spot in my whole life, I can't. I'm not one of those people. I can't do it. I just can't do it. So I have to be doing different things. I have to do different things. I love to learn new things. But anyways, off subject of that, I got hired to do urine testing for the patients at this pain management's office. So that was definitely interesting for sure. I got to learn all the different, you know, all the different testings that you can do and what can show up, I guess. But it got sent to the lab because we didn't have testing there to actually test. So we sent it to a lab and actually sent it to TrueFit because they had a lab down there. So we sent it to TrueFit's lab and they would test it and they would send back the results to us and tell us what was positive, negative, or whatever, making sure the patient was taking their medications and that they didn't have anything else in their system that shouldn't be in their system. So that was interesting and different for sure. So, I had fun doing that. And it wasn't really until I kind of had issues with the manager at that place, because with my job, I was allowed to leave and go if I wanted to, because I wasn't actually hired by the doctor in the office. I was hired from, it's almost like a third party situation. So if I was done with my patients, then I could leave. And so I would do that. But then there was times where all of a sudden things changed and either the nurse or the doctor wanted a patient to be tested and I wouldn't be there. And so that caused issues and problems. And um, that was just not fun to deal with. And then there was just, how there's always drama in offices and stuff. So, mainly what I wanted to talk about with what I saw that really opened up my eyes was there were drug reps that would come into the office. And I remember the first one that came in the office. And these drug reps, which were very nice, that I didn't have any issues with them. They were very great, very professional, but they were selling this drug called Subsys, and it was a fentanyl spray. So you spray it under your tongue and it goes in your bloodstream quickly. And we all know about fentanyl, but this was back in 2013. This was before we even knew about the fentanyl, you know, like the opioid crisis and fentanyl. And so I didn't know this fentanyl was so bad at this time. And honestly, it not only that, but there were patients that I had definitely seen for months. I think over a year, I've seen these patients. I get to know these patients and have a relationship with them that was on a acquaintance level of understanding and being there for them and knowing some of their lives and who they are. And it was very sad to see these patients that there were a few patients that were prescribed. I know there were quite a few patients that were prescribed this fentanyl spray, but it was sad to see a few of these patients that never had problems with their UAs or anything to then start having other medications in their system and how addicted they got to it, how quickly they immediately got addicted to this fentanyl spray and would run out and need more. And I remember we've, there was a patient that got fired and was on the sepsis spray and maybe something else, but I'm not sure. But it was very sad to see this patient crying for help because they knew that they got addicted to this medication that they said they ruined their life. And I looked at this patient and I couldn't see who this person was anymore. It wasn't the patient that I knew before that medication. But unfortunately, not only with the drug reps with sepsis, there were multiple drug reps that came in to the office. They would bring us lunch. They would definitely take the doctor and the nurse. And sometimes I was invited to dinners to have free dinners, and they would be nice restaurants. And anything we kind of, asked for or wanted, they would bring it. If we wanted lunch one day, we call into the drug reps and be like, hey, can you just bring us some lunch? And they go, okay, yeah. And they come over and bring us some lunch or whatever. And I never knew that there was actual doctors out there who would prescribe medication and get paid from the company that they were prescribing to the patient. So anytime they would prescribe a medication to any patient, they would get kickbacks for it. They get paid for it. Or they would have another deal with these medical companies. Just like they would have a deal of, oh, hey, you're a new doctor, you want to open up an office, we'll help you with that office, we'll even pay for that office, but you have to take your patients to our MRI building, and they all have to get MRIs at that specific location only. And people may not believe that. It's true. It's true. There's other things I could talk about that happened in this pain management job, but unfortunately there's a court case going on right now and it is still ongoing, and I am not going to talk about really a lot of I'm not going to talk about the whole details at this point because it's still ongoing. And there are people involved that I still am very close with that I'm not sure if they're comfortable with me talking about it. I would definitely not bring up names at all. If they're not comfortable with that. And I would never do that to someone unless I asked them and they said okay to that. But another thing that had happened was you would have drug reps come in or other men from different medical companies come in. And especially as a younger woman, I was 22, I think it was maybe 21, but definitely, I was 21. So I was 21, turned 22. So I was very young. I was very, very young. And you can imagine things are a lot different now here, and now that I'm 30, but yeah. Um, I'm not, I wouldn't, I'm not gonna sit there and be self-centered and talk about, you know, being hit on a lot by men and, all of that. But there was there was times where there were men that definitely were not uh doing the right thing. There was I'm not sure if he was a drug rep. I think he was, but he already was causing some issues already, and they were trying to let him go anyways. But I remember at this time, he was pretty creepy. He would kind of creep around, and he would try to like get me cornered to talk to him. It was very uncomfortable. And I remember at this time I was having like really bad migraines, and it was the migraines for like a week, even with medication. And I would try I tried everything, but I was laying down in one of the office rooms on like on the patient, bed, or what patients lay on. And so I was laying on that in the dark, and I had the door kind of slightly open, just a little bit, because I won't, and I heard people come in, and it was this, I can't remember his name. I can't remember his name, but he came in, and he was asking about me, where I was. And he came into the room whenever I was by myself, and just just creepy guy. And I can't remember exactly what happened, but it was bad enough for him to get fired for sexual harassment, because I can't remember if it was something he said or if he actually like touched me. I remember he asked me if I wanted a back rub, or if he wanted me to give me a massage. He wanted to give me a massage. And I'm pretty sure he was like touching me, and I just didn't know what to do. And yeah, I immediately told, and he got fired. So yeah, had to deal with, these men and drug reps and people from the medical companies who were just not professional and very not well behaved, and dealing with sexual harassment. I've dealt with a lot of sexual harassment in the workforce, unfortunately, in my life. And it's sad that I've had to deal with that. It's just, it shouldn't be something where I have to go to any kind of job and have to worry about a man saying something to me that's inappropriate, or doing something that's inappropriate. But um yeah, so once again, I think that was, I had wrote down a lot of things, and I don't have anything for the pain management job that I had. And I'm sure I have, I'm sure, I'm sure I have some more information maybe that I had dealt with in that office. But at this time, I don't, like I said, I don't want to say a whole too much. But one more thing is, um the reason why there's a court case, and I'm just going to name this one thing, is because there was pain cream that was being written to patients. And this pain cream came from there was a drug rep, or like I said, medical, somebody working for TrueFit. It was somebody working for TrueFit. I know who this is. I'm not gonna say his name, but he was involved and would get paid if there was a pain cream that was written to a patient. Each time it was written to the patient. So there was negligence and there was fraud going on. And the sad thing about what's going on in the healthcare industry right now is that doctors, nurses, healthcare insurances, big pharma, any part of any kind of providers or medical professionals, whoever, insurances, whatever, get a slap on the wrist when they get caught doing fraud or something that is not okay. And they just get fined. They go, okay, go to court, and they just say, oh, okay, just pay this much. Bye. And that's it. You think they go to jail? You think there's really any justice? You think that they really learned anything from that? No, no, no. And it's sick. It's sick that this is it is a ongoing issue. And it's still happening. It's happening everywhere. And I'm not sure if people really know that this really happens. I know that there are talks of it, but I don't ever see anybody who has worked for a doctor or a hospital or wherever and come out and say, hey, this is what's going on. This is happening. Speak up, please. If you know me and you worked with me and you want to speak up, hey, I'll come over. I'll come over there. We'll film, and you speak up. Let's go. Let's go. There's got to be change. There's got to be things that people know what's going on. And it's things have got to change, especially with the healthcare system. And after the pain management doctor closed the office, I was moved to the corporate office at TrueFit. And the owners, there's two owners, they're brothers. And I would say they, at that time, they were in their late 30s or in their 40s, like early 40s. I want to say they were in their late 30s. But it was obvious that there was weird stuff going on because the women that were hired were very pretty. And I'm just going to say it at that. But I was put into the lab. So I learned how to how to work with urine, putting in the information to get sent off to get tested. And I wasn't very welcomed there. I tried to I tried to be nice to the people at that, the coworkers that I was working with. There were a few who were actually, very nice, but the rest of them were drama and talking. And I I just tried to do what I could to fit in. One of the managers there obviously had a problem with me for some reason. Um, which is which is funny because I when I was having a lot of health issues with my endometriosis and PCOS, and I was having a lot of pain during that time, and I was actually in the hospital at that point, and this is a time where they could not find out yet what was going on with me. I didn't know yet at this time, and I was working with TrueFit, that I had endometriosis and PCOS yet. So I was having this pain, extreme pain, and problems that I had no idea what was going on. And there was times where I wasn't getting much sleep, or I was in the hospital and they're not getting sleep, but I still went to work. And there was times where I was nodding off. I was nodding off because I was tired. And one of the actually a few of the coworkers and the manager was talking to, I guess, HR about, um, I guess they thought I was on drugs. they, I guess they thought I was on drugs, and they had told HR that I was nodding off and that they were trying to get me fired. And I was brought up to HR, and I'm gonna say her name because she is no longer with us anymore. She is out in the spirit world. Her name is Janet. And this was a very important person in my life that had changed a lot of things. And even in the short amount of time that I knew this woman. And Janet sat there and called me up, and she said, what's going on? What's this happening that, saying that you're nodding in and out? Are you on anything? And what's going, and I talked to her and told her things that were going on in my life, and what was happening. And I said, you can drug test me right now. And I said, I will pass it. I said, but I can't tell you if all of if they could pass a test. And Karma, the people that went and told and said that I was on drugs, they called to do a drug test. I think the next day, those people that called to try to get me fired, um, left and didn't do the drug test because they knew they couldn't pass it. And it's not that I was happy that they lost their jobs. I would never rejoice of somebody losing their job. That's not me. But I then was called up to Janet's office again, and she asked me if I wanted to work in HR with her and be an HR assistant. I've never done that. And I said, sure, why not? Let's go. And that was a very fun experience. We talked about certain things going on. I had a abusive boyfriend. My first serious boyfriend was physically, mentally, and emotionally abusive. And I talked about my story with her, and it was almost the same exact story. And there was also other things going on, but I had heard things with the managers and the owners of TrueFit, and I had heard things that were, you know, oh, you don't say anything, don't say anything, and if you need to fire this person because we can't have them saying anything. And anytime that they would get sued from an office or a bank, I don't know if they got sued from a bank, but I'm just naming out things, places that they could, get sued from. But let's just say offices for now. So anytime they would get sued from a doctor's office or an office or hospital, they wouldn't put it in under TrueFit. They would put it under one of the brothers' names in court. So if a doctor's office is wanting to look up TrueFit and do background checks just to see if there's something, if there's been any shady stuff going on from a company, they're going to look at that, and they're not going to see anything from TrueFit. But people fail to look at like other, and then the other brother was basically the CEO, and the other brother was like right underneath him. So they put the when they got sued, they put it under that brother's name. And that was something as well that people don't know. And this happens all the time with big pharma. All the time with big pharma, when they get sued for legitimate, sometimes it's not legitimate, but legitimate reasons, they don't do it under their main name. They have multiple names within the system. So even if they get sued, say they get sued, it was under a blah 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 LLC, something that's not even the name of what they actually are. And that's it. Like nothing happens because they have multiple corporations of different names. And that's how they get away with it. And that's how these doctors, these medical companies are getting away with things, because they're not getting their name tarnished, but they'll tarnish someone else's name or a different name that doesn't even apply to the actual company. And once again, I'm not going to I'm not saying these things to hurt the company at all. I'm not doing that. I'm not, because it's not, I'm not doing this to get profit. I'm not doing this for any reason. I'm doing this to just bring examples of what's happening. And that this is my experience. This is my experience. Someone else may have a great experience with that company, but I did not. I worked with TrueFit for 4 years and I never got a raise. I never got a raise. I asked for a raise every year and never got a raise. And there was a woman that the woman that actually told me about this job, TrueFit, and to apply. She actually worked for a neurologist, a surgeon, but she worked with TrueFit, and they would have these Christmas parties every year. And we went together at the Christmas party, and she was talking about how she wanted a raise. She didn't know how to go buy it. And she thought since she had a few drinks, she was more comfortable with asking the CEO for a raise. So she does. And there's this guy that worked with TrueFit. I don't remember what he sold, but he was like a salesman, sold something or products or something with TrueFit, that he had a crush on this girl and wanted to go on a date with her. And I think he tried and she was not interested. But he was even talking about that night. So the girl goes and asks the CEO for a raise. And all I know is she comes back and she's crying. I'm like, okay, what's going on? What happened? And she said, I asked for a raise. And she said that he wrote down that he will give me a raise if I sleep with the guy that likes me. And he wrote it down on a piece of paper. And sorry, this wasn't the CEO. This was the brother underneath the CEO. I told her, and I said, do not tell anyone about this. I said, keep your mouth shut. I said, call a lawyer first thing in the morning. She was drunk. I kept telling her, because she was sitting there saying, oh, well, I should talk to the CEO about this and get this figured out and all of that. And I just said, no, you need to call a lawyer in the morning. I said, you have no idea that you got something against them now. And unfortunately, she goes to the CEO. She tells him, and I'm watching them. I can't see them have the conversation. And I can see them have the conversation. I can't hear, but I was watching. And she was crying and telling him, I guess, what's going on. She takes out the paper. What does he do? Takes it from her. But that wasn't me. And like I said, I don't have proof of this. This is just my story. So once again, take it how it is. But I am being open about everything that had happened in the healthcare system and what's everything, and then they would also have Fridays. Every Friday they would have, it was fun, you could relax, but also in the afternoons, they actually had a room that had just full of alcohol, just bottles, different vodkas, whiskey, anything. And they would let us drink. We were allowed to drink, and we were allowed to drink and work as well, which, doesn't sound like any other job would do that, but it was interesting to say the least that eventually kind of caused some problems. There's people that can't behave when they're drinking. And unfortunately, when I was working as an HR assistant, Janet had passed away from a heart attack. And I think this was a month before. This was a month after I was actually moved over to learn about medical billing. And because TrueFit had decided that they were going to do medical billing, that they were going to start medical billing for their company, and I guess do it for like their urine. And they also had DNA, where you could do DNA testing. This was DNA testing to see what kind of medications, how they metabolize in your system. It's actually pretty neat. But I think everybody should do that, because it really is. It's really cool. It tells you if, certain medications work or not, if it's good, or if it's like won't work. And what's crazy is I got one done, and apparently the main seizure medication that that is given in the hospital, and I think even like an ambulance, or is, if I had a seizure and I was given that medication, it wouldn't work for me. And apparently morphine too. Morphine I metabolize apparently pretty quickly than most people. So it's just really interesting. So, but anyways, they decided to, they wanted their own medical billing company. So, then they moved me again. They moved me to medical billing. And do you think they gave me a raise? No, of course not. And what's interesting is in high school, I tried to go into learn about medical billing because I was actually wanting to know about medical billing and interested in doing maybe medical billing, but the class was too full and I couldn't do it. So I had to choose graphics and imaging at that time. But it's weird how the universe works. And I ended up in medical billing anyways, not even going to school or knowing anything. That was when I was first taught about medical billing. And so that was, I think, around 2015. I want to say it was 2015 or 2014. But either way, I had issues with the manager at some point. I can't remember exactly what was going on. I know it was about my health, and I asked for accommodation. And at this time, you know, I don't think they knew anybody who was on ADA or anything like that. So they never brought any of that up. But I knew I asked for accommodation. And I know that there was some weird stuff going on at the end with my job there. I I remember looking at my pay, and it looked like it was changed and lowered $1 less an hour than I was hired for. And so I asked for my original contract that I signed from them because I never got a copy of it. And I kept asking the main manager. I kept asking her. I said, "Hey, I emailed her too multiple times, and hey, I would like to have a copy of my contract that I signed in the beginning. Would you be willing to provide that for me?" And there was just excuses. I never got it. I never got a copy of it. And when I brought it up to HR, when they had a new HR lady, um, they didn't care. They didn't care. And when I asked for accommodations for working with, because was having health problems, they also were just becoming more hostile towards me. And I I fight back. I fight back whenever when I get it back to me, when it was not necessary. And so I can't remember exactly what happened. And I may have to go back to my emails. I don't know if I have anything, but I looked at a lot of emails here with Change Healthcare, which that's the next one I'm going to talk about. I There was something going on. I can't remember, but I remember I knew I was discriminated against. And so I went to HR, told HR, they told the lady that, hey, my manager just or supervisor just discriminated against me. What do I do? And then they just said, nothing. It's like, oh, okay, great. Well, they didn't just say nothing. They just said that they would talk to supervisor and get their story and figure out what's going on. So at this point, I remember um, they talked to the supervisor, and apparently they call me up, and the supervisor's there with HR and got written up for it, basically written up for whatever what happened. Like I said, I don't remember. I need to go back and look on that. So all I know is I got written up. It was not necessary. It was not okay. Um and that's when I quit. But honestly, one of the reasons why I quit was I was working with Medicare and Medicaid because we weren't working with a whole lot of insurances at that time. And of course, Medicare gives the biggest reimbursements back. That's why a lot of doctors work in Medicare. And there was, I want to say, 4 CPT codes that were used for the DNA testing. And I think there was, I want to say, 6 codes for urine testing. And they all had different reimbursements and amounts for how much, because it depends on what was tested and all of that, how many units, everything. There's a lot that goes into it. And so the doctor that works with the DNA lab and does the DNA testing, I would only see him a few times, but he actually came in one day when we were working and was wanting to see the billing, like how the billing was for the DNA testing. And he is looking at it and seeing the codes, and he goes, can't you just put in another code? Can't you just put in another code to make more money? And, we're like, what do you mean? And he goes, well, that's not enough. No, he said we should be coding for more than what you guys are coding for. We told him, you can't do that. That's illegal. That's fraud. And he literally told us that he doesn't care, that we need to bill all of them for the highest amount, and it doesn't matter. And I knew that at that point, I'm out. Like, I'm not doing that. I've already dealt with that with my previous job. I'm not doing that. I'm not doing shady stuff. I'm not going to be involved in fraud. I'm not going to be involved in that. That's not, I don't want to be involved. And so I quit. I quit. And then I got hired at what the company name was, and what a lot of people know is McKesson. And so I got hired at this company, McKesson. And I was only there for a little bit. And um, it was okay. I didn't have really any problems yet with McKesson, because I think I was only there for like 2 or 3 months. I was only there, I think, 2 months. And I get a call from my previous manager from uh, the pain management office that I kind of had issues with, or she had issues with me. I know she didn't really like me, but she called me up and she's like, hey, you know, I'm working at this, really small medical billing company. And it was literally right across the street from where I worked with McKesson. And she said that it pays more than what I was working with McKesson, and that I could work flexible hours, come in and work however many hours I want to work. She says, if you want to work 3 hours, you work 3 hours. If you don't want to work 5 hours, you work 5 hours. And I was like, really? I said, that's awesome. So I had an interview with the manager and, told her, I said, I'm good. Like I said, I said, I can work 40 hours. I said, I can work 40 hours, but if you guys are flexible, I'll work, I'll work whatever, I'll see how it goes. And um they knew I had health problems and that I was about to have a surgery because that was 2 months before I had a surgery. Yeah, 2 months before I had a surgery. Or no, 2 months. Maybe a maybe a month. I don't know. Either way. um, so I started working for this small medical company. And it was the last medical billing company in Tulsa that does paper still, because everybody else is online. So there were just boxes of paper, paper everywhere. And it was really fun. I actually really enjoyed that job. That was actually one of my favorite jobs. And I was chill. I was cool. There was times I would come in really late. I come in at 11 a.m. and I would work maybe till 3 p.m. or 5 p.m. and leave. There's some days I only worked like 2 or 3 hours and I would leave. And all of a sudden, this flexible schedule that I was told about by everybody was becoming a problem. And I was pulled aside and I was told, like, hey, you have to start working 40 hours a week. I'm like, what are you talking about? We were told that or I was told that this was flexible and I could work. And apparently they just didn't like that I was working only, less than 6 hours a day, most days. And I was like, okay, you know. And so I basically said I have health problems. This is why I took the job, was for flexible work, to work. And once again, I asked for accommodation for this job. And then I was told that I had to be at my work at 9 a.m., no later, and I had to work 8 hours a day. So then this job turned into full time, not flexible. And a lot of it stemmed from this manager from my payment work. We worked at pay management, and I knew she was talking. I knew she was talking about me and, you know, conniving behind my back. And she didn't like that I was, you know, doing the flexible job. And when she was working all day. And if she had a problem with that, which I think she did, I think she talked to me about it. And I'm not sure, I can't remember. But either way, I felt I felt literally betrayed, betrayed because I was told one thing and it was not that. It was that I was doing that. And then I was told, yeah, you can't do that. And when I asked for accommodation, it was, oh no, you got to be now here 9 a.m., no later. And I'm not kidding you. They were waiting to fire me. For some reason, they started having issues with me and they would give me an attitude. Even the manager, she would give me like these looks, like all of them. And they are all women except for the main, basically the owner. He was a man, but I didn't have really any talks with him. He was very quiet. I didn't have any issues with him, but all of the women were just eyeing me and being rude and wouldn't talk to me, being passive aggressive. And I did nothing. I did nothing to these women. I did nothing to these women. And all of a sudden, everything in the whole environment just switched completely. And I could tell that they were waiting to fire me. They were waiting to do it. And one day I left on time, but there was a train. So there's trains here in Oklahoma. There was a train and I had to sit there was a long fucking train. And then there was a huge thunderstorm coming. And I'm driving through this thunderstorm and I'm stuck behind these cars. And I'm not kidding you, to my I get to the parking lot. I literally get to the parking lot of my job at 9 a.m. and I'm about to get out. I'm not kidding. I'm about to get out of my car because I just got there at 9 a.m. About to get out of my car, and I get this text from the manager that basically she told me that I needed to be there at 9, and that we made a deal, and um, that I was 9 and I wasn't there, and that I was fired. And literally I was shocked. I was like, really? This is bullshit, because I just got there. So I tried to call her. She wouldn't answer her phone. And mind you, I have personal belongings in that place. So I'm like, okay, if I'm fired and I'm already here, I need to get my stuff. And so I texted her back and I said, I actually am here. I literally got here at 9. I'm at the park. Like I said, I literally told her that I got out of I just got out of the car, and you sent me that text. I said, I'm literally outside right now. And I get no reply. And I said, I told her, I asked her, I said, am I still let go, or can I come in and work? And literally they're like, oh, you can't come in and work. And I said, well, I need to get my stuff. Amy needs to get my stuff. And I just said the name, sorry. But yeah, no, I said, I need to get my stuff. So I got my stuff, and that was the end of that job. And then I got rehired back at McKesson, October of 2017. And McKesson then transitioned to Change Healthcare. And mind you, before I talk about Change Healthcare, because this is a long video, I did not think this was going to be this long. I thought I was going to get through this pretty quickly. And obviously, this is a lot. So I didn't realize when I was going through all the crap at Change Healthcare, that I was entitled to ADA at that job, that flexible job, and that they didn't provide accommodation, and I could have sued them for that. And unfortunately, I didn't know this because I I just didn't know yet. I didn't know these things, and so until I started actually going into them, and that leads me to now Change Healthcare. So we transitioned to Change Healthcare, and mind you, Change Healthcare is actually now just recently merged with United Healthcare. $13 million. Can you believe that? 13 million. But they give their workers like 10-cent raises every year. Oh, and COVID, they didn't give any of us raises. We had to give up our raises during the year of COVID. even though they made profit, good money, but we didn't get a raise. But it doesn't matter. It's cents. It's literally Change Healthcare doesn't care about their employees. It's profit over people. And they're also woke. You know, they built this system of you can go on their system as an employee, and they have this, I forgot what it's called, but it's almost like a Facebook. You get on there, you can actually post and you can reply to people's stuff. And the CEO of the company used to have where employees could post on his profile to ask questions or if there was issues. And then he obviously took that off because there was a lot of crazy issues going on. And Change Healthcare loves to also offshore. They love to not give Americans jobs. They'd rather offshore their jobs because they want to pay the least amount of money, but they want to act like they're helping. They're helping the community. They're helping for healthcare, for patients, and for doctors. No, they're helping for their fucking pockets, is what they're doing. They don't give a damn. They don't give a damn about the people that actually make them money. They don't give a damn about, like, when I was a medical biller, and they didn't give a damn about how much we actually did and how much we saved them money. And we as medical billers were actually better than the people who were hired or who were coders and actual billers that had like college experience or had their what you call it, but they went to college and got their degree for that certificate. And a lot of us that didn't have that, that just didn't know about medical billing, actually were better than actual real coders and billers, which is crazy. It's kind of funny, but yeah, Change Healthcare. I don't have anything really good. I don't have anything good to say about Change Healthcare at all. At all. Actually, Change Healthcare could be a good company, but they fucked that up royally. Fucked it royally. Because whenever it was McKesson, it was actually it was actually a chill in kind of like a family environment. It was actually okay. But when we transitioned to Change Healthcare, it was like just bullshit. You know, the managers would come one day and say, oh, this client and this client, they want this. Okay. Um, and then the next day they'd be like, oh, they changed their minds, or oh, they don't want that anymore, don't it? You know, and then it's like you already did that work, and then it'll come back on you. And it was always like flip-flop or this or that, or um they would always change you to a different job. So if you got hired as a biller, they would put you in somebody else's position. And also they would give you um, they would give you other work, or whatever they call it. Forgot what they called it, but they would give you other work that someone else couldn't get done or needs help getting done. Um, and then you have to do that work plus your work. So now you have someone else's work plus your work. You think you get a raise for that? No. I asked for a raise multiple times. Never got it. I finally got a raise the second year whenever we transitioned to Change Healthcare, and it was literally 10 cents. 10 cents. When we have to do 55 claims a day, which is a lot, and you get QA'd for it. And if people don't know what that is, that means that it's like quality assurance. So someone offshore obviously looks through, whatever claims of, like, I think it's 10 random claims that you did that month, and make sure that you did them correctly. And if you didn't, they would go in there and they would make their comments, and then they give you your score. And there were times where they would be so wrong and you have to rebuttal it, which is bullshit. So you rebuttal it. And I never had any issues with my assurance. I don't even think I failed one before. I may have one time, but that was because I was put on a new project that I had no training for. I was just put in it and had no training. And yeah, that's what happened. And so, um, yeah, so I came in to Change Healthcare, and I immediately in my hiring process, in my interview, I told them I told them on my interview that I had health problems, that I was going through infertility issues. And this was the time, it was about a year, well, 2017. So yeah, it was about a year and a half. I want to say year and a half. I was going through infertility, and I was having issues, and I was having to go to the doctor. And, the one thing I would say about Change Healthcare was their insurance at that time was actually decent. They actually had insurance that covered infertility, where you could get, I think, $15,000 or something through you could get one IVF. And so that was actually really nice. That was really nice. So, yeah, I told them that, and I got hired, and they knew I had health issues anyways. And at this time, I was going through infertility issues, and I went to an infertility specialist, and they had told me that, oh, you know, there's nothing we can do for you at this time. The only thing that we have is this medication called Lupron, and it puts you in premenopause, and it stops your periods for a certain amount of time. They wanted to do a shot once a month for 6 months. And literally, that's all I was told about. But I did research. I looked at Lupron, and I realized, oh shit, it's a chemotherapy drug for advanced prostate cancer. It's actually chemo. Um, yeah. So, anyways, I didn't want to do it, but I wanted to try at least to see what it was like for that month. And so it was the most fucking awful thing ever. And um yeah, so um I couldn't even miss work during that time. They wouldn't allow me, and they would write me up for it if I did. I was going through actually chemotherapy. So yeah, that was really fun. So um to to really kind of step this up, because I mean, this is a long video. This is a long video, and I didn't know it was going to be this long. And I'm honestly, I don't even, I'm okay. So I actually did write every single thing up until April of 2020 of what happened with Change Healthcare. And I'm just going to read it real quick, like the things that had happened. And then I'm going to show a screenshot of certain things of proof of stuff. And I hope that, yeah, you could just see. So yeah. So yeah, so I put on here November 2017. I had let all my managers know that I was starting infertility treatment. So I was asking for accommodation at that point. January 2018, asked for accommodation again. My manager told me to apply for FMLA, was denied on February 16th, 2018, which I knew I was going to be denied. I went back and forth with HR and managers for accommodation with no luck. February 2018, once my FMLA was denied, I got written up for calling in while on chemotherapy injections. I also made up time and did what I needed not to lose my job, as my managers threatened to take my flex schedule away. So the flex schedule that they had was, they had this policy for flex schedule. So you could come in anytime from 6:30 to 8:30 and clock in, and any time between those times, and then you work your 8 hours or 9 hours really. Um, and if you get the flex schedule taken away, you have to choose a time that you come in every single day, and you're not allowed to change it. So, yeah, that's what their flex schedule was. So, March 2018, incident where I needed mental help from chemotherapy injections, and my manager told me if I left that it would count against me. So, I did not leave work when I was told by my doctor to leave. So actually that day, I was having severe depression, and I actually was having thoughts of killing myself because the chemotherapy was really messing with my head. And I called my doctor. I told told them, I said, what do I do? They said, you need to come to the office immediately. And I told my manager, I said, hey, this is what's going on. My manager literally told me, I think it was sent an email, but I don't remember. It may have been in person, but either way, told me that if I did not, if I left, that I would get written up for it. So yeah, I told my doctors I can't leave because they're gonna write me up for it, and they're like, "You need to leave, like you need to leave," and I said I can't, and so I didn't because I didn't want to lose my job. So yeah, next one is April 2018. I did not miss work for uh, that one is okay. Scratch that. May 2018, put back in a room with two managers with a coworker. We were told if we did not move to this other job position, that we would be let go. So we had to sign a paper that day and was given no copy of it. Um, I said I started seeing specialist. I started seeing specialist in May, but could no longer do treatments because of PTO issue. So at that time, I still didn't have an accommodation, so I was using my PTO because you don't get sick days either. You just get PTO. And even if you're sick and you have to call in sick, they count that against you. Even if you have PTO and you use it, they still count against you. So yeah, I couldn't see that's my specialist anymore, fertility specialist, because I had no more PTO, so I couldn't even go to the doctor. And during that time too, as well, they did put us back in a room, and they told us, me and my coworker, that if we didn't take this job position, we would be let go, that we had no other option, and that we had to sign this paper that says we agree that we're moving to this position. I did ask for a copy of it. I did not receive it. I asked for it again I think the next day or a few days later, still never received a copy of that. June 2018, I actually spoke with the ADA, which is the American Disability Act or Accommodation, or I think it's Act. I spoke with a woman from the Western region, which is in my area, and she advised me that infertility was covered for ADA. And finally, when I had I said finally was applied for ADA on June 25th, 2018. I had sent the vice president for Change Healthcare an email on what was going on, and she did nothing. Spoke with HR on June 19th and June 22nd. I had a coworker that asked rudely if I was going to work today. I told both HR and my manager because she was being rude, and I was busy actually doing things that was involving what I had to get done at my work anyways, which was none of her business. And so, yeah. So June 28th, had conversation with my manager, advised her that I was pregnant. She told me that the ADA papers, when the ADA papers get denied, that they are waiting to write me up. So, and even then too, she had told me when I told her about my pregnancy, she said, well, hopefully nothing bad happens to your pregnancy. And I was really, that's not something you tell somebody after they've gone through infertility for 2 years and finally get pregnant. So, yeah, and then threatened that they were waiting for my ADA to get denied. They were actually wanting my ADA to get denied so they could write me up, so they could fire me. And so here I put July 12th, a doctor told me they fixed everything for my ADA and kept getting told that they never got it. So the company Matrix at that time that was doing my ADA, that is supposed to get the paperwork from my doctor, kept saying that they never received the paperwork from my doctor, even though my doctor had proof that it was sent to them, confirmation, and they kept saying that they never received it. So sent an email saying I was stressed, and an hour later, I did start bleeding and I went to the ER. July 26th, ADA approved, and now I do not have to use PTO for those days. I can't remember what I put there, but I said I went to the EEOC during that time. So July 31st, my manager brings up my lunch breaks and that was never a problem before. So she was just bringing up anything she could. August 2nd, 2018, called EAP, which was basically like HR, or you report for like harassment, discrimination, whatever. They called EAP. Actually, no, I'm sorry. EAP was something that was like mental health stuff with the company. The company provided mental health, like for insurance. They had EAP that you could call if you needed to call them. So I called them, and I was stressed because my managers, and I was getting no help from HR. I started bleeding that night and had to be put on bed rest. And then August 3rd, 2018, ADA was approved. Managers backed off. August 7th, 2018, sent a manager an email about my ADA approved and PTO issues. The manager came back to my desk, told me she was working on it. A coworker was listening and asked what was going on. I told her my ADA got approved. She then asked me if I was going to be replaced because she doesn't like me leaving work. August 10th, 2018, the coworker rudely asked if I was going to do any work today. I told her to mind her business, and she unfriended me on Facebook and posted a threat. And the threat was going to beat a bitch to death. And that's true. August 13th, I want to say this is 2018. It was 2018. Left HR a voicemail about the situation, called back, told her that I did not feel safe to go back to work with what she had said and posted, and would like to be moved away from her as soon as possible. August 20th, 2018, had a meeting with all the managers, was told the PTO was not going to be given back and that they would take back the write-up. I was given they were taking back the write-up I was given, but I still never got a copy stating it was reversed. Then I asked if they heard yet about what happened with the coworker and the threat, and they had no idea what I was talking about. So the managers were never told about the situation. September 6, 2018, asked manager to put PTO in for last week. She refused and said it has to be put in advance. I called HR and they advised me that I can use my PTO, and they put it on for me. September 24, 2018, screenshots of two of my coworkers and the other coworker being rude, talking about me, that I sent to HR. So November 8th, 2018, the manager CC'd an email with another manager, told me I need to notify if I will be out or I will be no call, no show. I told her I would be out that week. She knew this. Looks like then I was out I was out in December 2018 on short-term disability, also for January, February, March, April, May, because I was pregnant and had issues with my pregnancy. And so I was out the whole time. So April 4th, 2019, I wrote the CEO an email about my ADA and matrix and issues going on with that. July 29th, 2019, two co-workers had given me a write-up for my production, which my manager told me I would not be that I would not have QA done for June, since I was out for 6 months and had to get training and read all the new names, and I had issues with my phone and computer, and I rebutted, and I never and then I also sent them the main manager in our area, and to talk to her face to face. And then when I did, she literally said there's nothing she could do for the write-up. And I was told by my manager when I came back that since I was gone for 6 months that I had to get all new usernames. I had to get everything put back up. It was a mess. And she told me I wasn't going to get QA because I was also put on a new project. I had to get trained for it, which I didn't get trained for it. I was QA'd anyways for it. And that's the one that I actually didn't pass because I didn't get training for it. And yet I got written up for it. So yeah, that's and then I had surgery, and that's when I had septic shock. And I was out from September to 2019 to February 2020. So then here in February 14th, 2020, emailed my manager. Email my manager because I was sitting down with a coworker as she was training me, and a patient pulled up that died from sepsis, septic shock sepsis. And at that time, I was actually going through some major PTSD. It triggered my PTSD, and I notified my manager immediately. Got no response back. February 24th, 2020, I emailed my manager because my manager sat me down with a different coworker who was in the hospital and was still very sick. And I let her know, and my manager know in the email, that I was uncomfortable sitting with this coworker because I was still having serious health issues. And I was afraid to get sick or have something happen sitting next to her. And received no response back. So here, February 12th, 2020, sent my manager an email stating I put ADA time for a certain day, and I had the confirmation number. This was approved by my actual manager for me to be out on, I was out on February 11th, 2020, and she actually put me as a no call, no show when my time is actually approved. And then she literally put me as a no call, no show and stated she never heard from. It's weird. She never heard from me. That's weird. I just realized that was a bug. So yeah, she said she stated she never heard from me yesterday. And then March 11th, 2020, I sent HR an email, advised I was sick, back in hospital. March 19th, 2020, sent my manager an email, let HR know that, I sent my manager an email that HR told me to stay home that week for the next week or whatever. Let's see. And then I was having issues with getting PTO for COVID and stuff. And since I was out and I was sick and I was in the hospital, I was supposed to get certain PTO that HR told me I was going to get. And I was having issues with that. And then it looks like here it says March 31st, 2020, my manager sent an email about the 55 claims a day. I asked her what the claim amount be different since I work 30 hours a week? And she replied, yes, it would be a little less than 55. And then April 10th, 2020, the manager called and said, if I don't make 55 claim production, I will be written up. Sorry, I'm still looking to see if I have anything else. So then it looks like here, April 13th, 2020, call People Connection, which is like HR, to report discrimination. And then I was on the phone for 45 minutes with the report and was hung up on. And then I called their ethics line, spoke with someone for 2 hours, was hung up on, called back, and was told that the girl I was talking to went on break and would call me back, never received a call back. Then that's when I sent the CEO an email of what happened. Then I received an email from HR stating they would call to discuss the report. And so that's where it ends in that. And so I'm sorry if that was extremely boring, but I just wanted to like put on there like what happened. And then there was issues with short-term disability, and I had to get a lawyer because my short-term disability was getting denied. They were making excuses of I wasn't sick enough, even though I had a life-threatening illness and almost died. But I got most of them except for one, I think, finally approved after like 2 years or something. But I still was having ongoing issues even after April. That manager that was constantly discriminating and harassing and retaliating against me got let go. I think it was in April or May of 2020. I'm not sure if it was because of that or if it was letting go because they were letting people go. I did get put on furlough during like I think it was end of May, and then they called me to come back after 4th of July. And it's funny is I had done new ADA paperwork and I was supposed to get an answer. And the day that I was supposed to get an answer on that ADA, they had put me on furlough. So when I got back in July, I had to redo the process all over again. So I had to go back to the doctor, redo the paperwork, get it done. And then it took like 2 or 3 months. It took till this big bug. It took till I want to say October. Yes, it was. It took till October because I was told to continue to keep acting like I had my same ADA. So at that time, I was working 30 hours a week because I was still extremely really sick. And I was pregnant during this time too, which is insane. By the way, I was pregnant and I had a high risk pregnancy. And um now yeah. So and then I had 6 days where I could use a month if I um needed to call in or leave work early. So um I still was continuing to do that because that's what I was told. And yeah, basically I had the phone call with HR about keeping my ADA because I wanted to keep my ADA the same. and they denied it, of course. So I was like, okay, well, can we at least just do 30 hours a week and maybe 3 days, 2 or 3 days where I can get off? And the HR lady had told me over the phone that she goes, well, I don't understand why you can't come in, or you can't work till 6 p.m. And I told her, I said, well, the reason why I can't work till 6 p.m. is I have to pick up my children from daycare, because daycare closes at 6 p.m. So I can't work till 6 p.m. I said I could work till maybe 5:30, but I said that's even really late. I said I like to pick up my kids at 5 from daycare. And after that phone call, she had put on the HR lady had put on um the report back for my ADA, that I used my ADA time, or I used my ADA time to pick up my kids from daycare. Like, completely lied. So guess what? My ADA gets denied because of that. So I report her for that. And I talked to somebody that's, I guess, pretty high up in Change Healthcare. And so I have a conversation with this guy, and I told him, I said, I never said that. I told him that he needs to listen to that phone call recording, because they say, oh, it's always recorded and blah, blah, blah. So I said, you need to listen to that phone call recording, and you will know that she lied. I never said that. And I said, why would I even use my ADA time to pick up my kids? That makes no sense. And I got no help. It was actually, it was, there was an investigation. There was an investigation. Um, but when I came back after my maternity leave in March of 2021, they weren't allowed to tell me what it was, because I guess they're not allowed to. But then they never tried to reprocess the ADA. I never got any information on any of that, of any of that. And so I had to redo ADA again after I came back. And it was the same thing. I asked for 30 to continue to work 30 hours a week, because that was working for me, and I couldn't do anymore because it would affect my health. And when my ADA got denied before I went on maternity leave, um, that means that the time that I missed after it got denied, because I think I missed 1 or 2 days, which I didn't know it was denied yet because I was gone. That I got written up for it. So in March, I get the phone call, what happened with the investigation, which they didn't really fucking tell me shit. They didn't do shit. They didn't help. And then they tell me that, oh, you're gonna have a phone call with your manager to talk about stuff. And then they're gonna write you up for, the like 6, what was it, 5 months ago. Oh, we're gonna give you a write up from 5 months ago. And they did. Got written up for it, by the way, right when I came back to work. And then I was getting sass from my manager again. And then it was worse. It was worse than it was. And honestly, I sent the CEO an email about that. I had so many problems and issues and discrimination and harassment. I had to report her again in the end of March. And then I think I had to report her again like 2 months later. I'm going to show you screenshots. I actually had screenshots for the sepsis thing, and I completely forgot to pull that up. I'm so sorry, but let me try this real quick. I'm going to pull this up real quick. This isn't what I want. So here is unable to schedule interview. I was actually contacted the EOC. I actually contacted the EOC a while ago, like 2 or 3 years ago, and I got a rude person, and literally they were for the company. They didn't care. They didn't care about my situation, and they told me that I was shit out of luck. So, but I did contact the EOC, and but then I didn't do anything with that because I just whatever. Here is, please don't do this. Please don't go back. Okay. So here let's see. This was back in November. So this was just, so I already lost my job at this point. But this is all the stuff that they ask for my long-term disability. So when I went back on short-term disability in May, the end of May of 2021, because I was getting so discriminated against, and it was my mental health was so bad that I had to go back on leave. I didn't know yet that I was on long-term disability, or I was supposed to be on long-term disability until 2 months later. I think it was in August I got told this. So let's see more screenshots. This one is July of 2021. So this was talking to HR, someone from HR. So this is literally everything that happened kind of in this time frame right before I went on leave last year. So you can pause it and read it. So here's all this. And this is all the stuff that happened right before I went on leave. And this was it for me. I have screenshots. So I sent her screenshots. I sent her a screenshot of my doctor, and then I was letting her know. This one. She was telling me something, and then I'd sent her 2 texts. She didn't reply. So yeah, if you want to read all that, you can pause it, read it. This is the same kind of situation. Pause it, read it if you would like. And then I have all the screenshots here. Once again, you can pause and read it. Pause and read it. And these are all the things that I had said that I was late, or I would be late or the doctor appointment, whatever. And yeah, so This was what I sent to the CEO here. Like I said, you can pause it, read it. I think I sent him the same things. Yeah, I sent him the same things. So yeah, once again, you can pause it, you can read it. Oh, that's a nasty bug. Sorry. Okay, so um so the last one real quick I wanted to talk about was um how they let me go. So here, once again, you can pause and read it. They sent me this email. I guess they're talking about all of the leave that they gave me in the past. And then at the end, it says that remains willing to explore accommodation that will allow you to work full time on or before August 12th, 2021. What's funny is 30 hours is full time, but apparently they don't consider 30 hours full time, which is bullshit. 30 hours is full time. And I actually sent messages or emails and I said, hey, if you're willing to transfer me to this supervisor, because I actually do very well with the supervisor. We've never had any issues, problems. He's extremely nice. I get along with him great. I said, also, if you're willing to transfer me to this supervisor and willing to let me work 30 hours a week, I said, I will come back to work immediately. I told them this, and they still continued to send me this email and tried to say that I that they can explore more accommodations or whatever. And that's BS, obviously, because you know they wanted to fire me. And what's funny is that anytime, doesn't matter, ADA, short-term disability, long-term disability, anytime that you get a any kind of request, whether it's you got a denial or it was approved, or you need more paperwork, or something went wrong, or you needed to like stuff like this, that it was denied, or they want to look into more options, I got paperwork for it. They wouldn't mail it to me. Plus, I would get a call from whoever was my caseworker at that time, and they would call me and let me know what's going on. So I would get a call. I would also get stuff in the mail, and then I could also go online and see that as well. But mainly it was phone call, and it was through mail. And I have almost all of it, all of this stuff still in the mail, like proof. I have all of it, almost all of it, or all of it. But anyways, this right here, they fired me in a pretty shady way, because I never got a call from anyone. I never got a call from HR or anyone from Change Healthcare, um, that this was going on, or they made a decision, and that they need, yeah. And I never got anything in the mail. I didn't get this letter in the mail. And they had somebody who I don't ever that has never emailed me. I think she's emailed me one time before, on my personal email. And that was, I think she was CC'd on it. I can't remember, but it was even like, it was years, it was like a year before this. The only time this woman from HR ever emailed me was through my work email. I never talked to her through my primary email. And I don't know why they had her send me this email, because I didn't see the email. I didn't see this email. I didn't know it existed. I I even emailed IT or whoever emailed me because they were asking for my computers and everything back, and I was confused. And I said, why do you need it back? Am I let go? And this was like 2 weeks after they sent me this. Apparently, I was already fired. And I also, was getting mail that my insurance was terminated. And I was confused. And I called HR, who I normally talk to, and they didn't even tell me that I was let go. They still acted like I was a employee. And it wasn't until I sent the CEO an email and I got a phone call from the guy who does my investigations for my or reports for my discrimination and retaliation and stuff, where he was talking to me and I was telling him what was going on. And he's like, "Did you not get the email?" And I said, "What email?" He's like, "Oh, we sent you an email about the ADA and it was denied, and that if you weren't back, that you were fired." And he goes, "So you were terminated." And I was like, "I never got the email." And I asked him on the phone, I said, I said, "Why?" I said, I said, Actually, I go through my emails during that time because I was talking to quite a few people because I had so many problems with my short-term disability and then long-term disability and getting paperwork. And I was talking to my lawyers too, or emailing my lawyers at that time. There was people I was talking to constantly still, even at Change Healthcare during that time. So I was checking my email, but the person that sent me this email, I never talked to. So I didn't see it. I somehow didn't see it. And I asked the guy that I was on the phone with, I said, "Well, why didn't anybody call me and tell me that what this was going on?" And he said, "Well, we just assumed that you emailing was the best option." And it's bullshit, because every single time I've had, like I said, phone call or mail, and you can have emails, and it's the same people you normally talk to. And so, a reason why I'm going through literally all of this, and this is a super long video, is once again, I don't want to put it out there that like they're trying to make them look bad. Because like, once again, I'm not trying to get profit from, Change Healthcare or whatever, or any TrueFit or, pain management, whatever. Um, it's more of, I wanted to show that, once again, these companies, they don't care. They don't care about you. You can be with a company for years and they give you 10-cent raise every year, and they watch you suffer while they make millions. Actually, let me share one more thing because I want to actually show. Um, Here we go. This isn't the one here. Here we go. It says, estimated 13 billion merger with combines United Healthcare, one of the largest companies in the US and the owner of the nation's largest health insurer and Change Healthcare, largest electronic data interchange clearinghouses. So yeah, they tried to stop them, but they actually did get it. And I got another one here. It says, yeah, here in 1996, Change merged with McKesson. 2017, Change currently sells for plan. Da, 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 da. So yeah, business see more than 50% compensation basis. Da, da, da. And it says TBG was first approached about acquiring the claims and more than 10 million on outside consultants on the high side, court document said. Da, 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 da. Business separated from parent without you. TBG will put 1.2 billion of equity in the acquisition, and the remaining 1 billion will be debt financed. So basically, they're worried about data being shared and all this bullshit of like, oh, they're gonna get more information from other healthcare companies and all this bullshit. And it's like, who cares? Because either way, these health insurances, they don't give a fuck. They don't. They don't. And honestly, it's there should be no out of network, or there should only be in network. There should be only in network. There should be your copay and then a low deductible, like $500. And that's even a lot. There should be no out of network because that's bullshit. It's all a way of just making money, getting money from people. And then, yeah, out of, your max out of pocket and shit like that. It's bullshit. It's bullshit. And that certain hospitals can have the same CPT code as this hospital over here, but this hospital can charge $500 more than this hospital. Bullshit. It's stupid. It makes no sense, and it's just all about money. It's all about money. And that's why I'm showing here is like with these companies that, and also once you get sick and you ask for ADA, it's over with because, they just think, oh, you're just going to be a piece of shit. And we want somebody else that doesn't have health issues. You think, oh, we have ADA. That will protect us. It doesn't protect you. It doesn't. It's a fucking lie. ADA doesn't protect shit. Especially in my situation, it didn't protect me because when you live in a what is it at will state, you can get fired for whatever reason, and they can just make a bullshit reason to fire you. And honestly, what they did to me was fucked up. And honestly, I may be able to still have something. I don't know. But I'm not, like I said, I'm not sitting here trying to go after them because, like I said, there's lessons I've learned in this situation of these managers that went after me, discriminated and harassed and retaliated against me. I'm one of those people where I don't take that and I will go after just as hard. So they know they can't do that. And so I hope that if I go at them, that they'll change or they'll understand. And I realize that it's a waste of time. It's a waste of time. And people may sit here and go, well, why didn't you just quit your job? Well, I got pregnant and then I got really sick. So at that time, I was getting accommodations and it was hard, but I knew that no other job was going to give me accommodations straight up like that. So it it's harder than what people think whenever you have chronic pain and chronic illnesses, and you're trying to just be a normal, you're just trying to work as well. But you feel like the world is also against you in that you can't get any help, and that other people don't like that. And it's just sad. And I just wanted to show in here that, the healthcare systems has to change, and that, you know, doctors doctors do get kickbacks. I'm not saying all doctors or nurses do that, but there are a lot of shady things that happen and go on that people don't know about. And that I wanted to do this video to speak up and talk about what happened with me and what I went through. I went through fucking shit and had to learn and realize that I should have just let it go, let it take its course. And yes, I I definitely messed with my mental health even more because I pushed so hard to let them not get that way with me. But yet they still won. And I think that's the problem though, is that actually they didn't win. They didn't win because I'm stronger than I've ever been in my life. And that they're honestly, I wanted to sit there and be like, I wanted to sit there and think I'm gonna win this. I'm I'm gonna win this. I'm gonna beat them at this game. But then you realize that I just wasting my time. I'm wasting my time with people who don't give a shit about me and don't value me as a person at all. And that honestly doesn't give a fuck. And these are things I'm learning. And I'm learning too that, there's just some things that it's just not worth fighting and trying to prove something that obviously is not going to do anything for me, for all of this that I had to go through. And this is a long video. So if you went through this whole video, I am so appreciative of this. I definitely am going to talk more about this. Please, please, please put in the comments or message me if there is something on here that you want to know more. I'm definitely willing to talk about that. Like I said, I do want to talk about more about healthcare and medical billing and what goes on within that. I'm gonna talk more about these situations. But at this time, I just wanted to put my story out, wanted to put my story out of what I went through and what I saw. And and I do also want to talk more about ADA, short-term disability, and long-term disability, because there are people that know this situation, have been through this. And I just want people to know that you're going to make it through if you're going through this situation, because I know it's tough and I know it's hard, but just keep going. You'll get through it. You will. And, I'm doing this now. And who knows what I'll be doing next and what will happen. But for now, you know, I'm putting this story out. I'll just see what happens. And hopefully nobody comes after me because of this video. But, I'm telling my truth. I'm telling my truth. So I appreciate everybody who watched this video. If you watched all of it, thank you so much. I did not think this video was going to be that long. Honestly, I thought this video was going to be pretty quick. I thought it was going to be like 30 minutes, but yeah, I just appreciate everybody. And thank you so much for, if you've been watching my videos, I appreciate so much. And I, I hope you're enjoying them. And I hope that, you know, I'll figure it out. I'm figuring this out myself. I'm figuring out where I'm really belonging, because I didn't think I was supposed to talk about health, but maybe I need to talk about health, or maybe it needs to be spiritual, or I can do both. So I just really appreciate everybody who has listened to this and who supports me and sends me encouragement and messages. And I thank you so much. It's amazing. It really is. And I just want people to know that you can literally do anything. You can do anything you want. And that if somebody in your family or friends or whoever is telling you that you shouldn't do something, but your heart is telling you to go that way, listen. Listen to yourself, because I don't want you to go back one day and realize that you should have done that thing and that things could have been different. But you still have time. We still have time to make other decisions. But either way, this is a long video. I appreciate it so much. And I definitely will be back. Thanks again. Love you guys.